I chose the field of dermatology and skin cancer surgery because early treatment and detection of skin cancer can save lives. We treat basal cell, squamous cell, and melanomas. Early detection and removal of these cancers is life-saving. I've been in practice for over 25 years. Prior to becoming a physician, I was a pharmacist and have a master's degree. I went to Downstate Medical School in Brooklyn. Then I did my internship in Beth Israel Medical Center in Manhattan. I am fortunate to have trained in one of the top dermatology programs in the country, the University of Michigan. Following this, I did a 2-year Mohs micrographics fellowship in the removal of skin cancers and reconstruction, as well as laser surgery. My biggest challenge so far is keeping both the patients and staff safe during this COVID-19 pandemic. We've instituted special safety measures. We had the office sprayed with a special chemical that kills both bacteria and viruses prior to reopening. We also have a halo system, a UV light system that kills both bacteria and viruses in the system as the air blows. We've instituted special safety measures. We clean the office frequently. We insist that both the staff and patients wear masks. We insist on chronic hand washing during the day. We have the staff clean the rooms and the door handles frequently during the day. We also insist that patients stay in their cars, call before they enter to minimize the amount of patients. My waiting room has chairs have been turned around to limit the amount of patients at any one time in the waiting room area. So far with these safety measures, we've been very fortunate and hopefully we continue to do so. One of my greatest achievements is treating multiple generations of the same family. I've had patients that came to me as teenagers who now come to me married and with their own families. We often have multiple generations of the same family that show up at the same time and they don't even know that they're patients here. Throughout the years, I've treated multiple patients with skin cancers, multiple melanomas, and early detection and treatment has kept them alive. I always keep abreast of the latest technology and treatment options for my patients. Presently, we're offering PRP, platelet-rich plasma. It's where we take out blood from a patient, it gets spun in a special tube, and the serum is injected for hair loss directly into the scalp. We also have a Theradome light treatment that also stimulates hair growth. For actinic keratosis and premalignant lesions, we're doing a red light treatment known as PDT. The results have been very promising and actually helps remove some of the early premalignant lesions. I've been very fortunate to work in this community as a dermatologist. It's been my greatest pleasure to work and treat patients for many generations and to save patients' lives with the treatment of skin cancer. I find it very satisfying and rewarding to do so.